most honored professional doctors from Dada Memorial Center, Mumbai, namely Dr. Subita Patel, Dr. Survana Kaur, Dr. Yaknik Voza, Dr. Ketovino, alumni of Dada Memorial College, Dr. Akash Anand, Medical Superintendent, Registrar of Birth and Death, HPCH Varanasi, Dr. Ruchi Patak, Malvia Cancer Center, Varanasi, Dr. Saman Gaman Chowdhury, Senior Technical Advisor, Center for Disease Control Foundation, Dr. Muhammad Hazifur Rahman, Technical Advisor, Center for Disease Control Foundation, Principal Director of Family Health and Family Welfare, senior officers from both the departments, Health and Family Welfare as well as Economics and Statistics, doctors and officers from across the districts, media, ladies and gentlemen. Medical certification of cause of death, or commonly called the death certificate, is an important tool of obtaining authentic and scientific information regarding causes of mortality. Mortality statistics is essential for better planning, management of program, formulation of policies, and for undertaking control measures in an effective and planned manner. It is much useful to know the impact of health services and to evaluate health indicators like infant mortality, maternal mortality, etc. Any planned activity or program can be successful only if the statistical information is authentic and correct. It is to be noted that with concern that Nagaland state is at the bottom 24th position among the states in India as per MCCT report 2020. Perhaps this reflects our indolence or lack of seriousness, which will not bring positive impact in the healthcare delivery services and other programs in the state to meet the target population. Only if we can implement the MCCT scheme successfully, then the state can frame a robust health policy and other programs. Further, as per the data of Cancer Control Program, the cases of cancer is alarmingly increasing in the state. Cancer treatment is expensive, which therefore makes prevention and early detection very important to ease the financial burden of the patient. Therefore, the two programs that we are going to launch today is appropriate and vital, and we are deeply grateful to all the eminent professional doctors who are here today to impart capacity training, provide technical support, and to strengthen the skills of our state doctors and officials. With these words, I take this privilege and the utmost pleasure to heartily welcome each and every one of you to the most important launching program of medical certification cause of death and affordable cancer care project in Nagaland, which is a result of Nagaland Corporate Social Responsibility Investment and Banking Conclave recently held in the state. Let this be the beginning of a new chapter towards progression of state health sector in the state. Thank you and God bless.
I proposed this idea to conduct this workshop, and in fact during last meeting only quickly we have organized meeting with statistics department, health department, and we came out with the idea to do this workshop. So as Madam Imiti said that why this MCCT is important. As you know, during this COVID crisis, there was a huge problem, and at the Government of India level and state level also, to whether how many people died of COVID. That was a big issue, sir. In fact, UP is the first state who made it mandatory. In the death certificate, they have added one additional column, remark, and they said that every doctor or health facility has to certify that, write down whether this death is from COVID or not. And UP government expanded this to all the disease. So they have made mandatory that in all the death certificate, as a doctor or the whosoever is responsible to issue the death certificate, we have to mention the exact cause of death. Why we have to improve this? So there is a saying that what you can't measure, you can't improve. जिस चीज को आप मेजर नहीं कर सकते उसको इम्प्रूव भी नहीं कर सकते हैं. So if you have to improve this registration, we have to measure the current status. So this is mandatory mainly because of the four reasons. One is to know the exactly why people are dying, to know the community health, whether people in Nagaland dying because of the cancer or road traffic accident or liver disease or kidney disease or some other maternal and child health issue. Unless until we know the exact percentage, as madam say, we cannot decide, take any policy level decision. Like if you know in your state maximum death is happening because of road traffic accident, then you can take policy level decision that the mandatory helmet, mandatory wearing of the seat belt. Right now the death of Cyrus Mistry had highlighted the importance of wearing seat belt in the rear seat. So all these decisions you can take only when you have good quality data. Third is also to measure impact of any program. Like if you have implemented this program, like I'll give you another example from Bihar. Bihar implemented this alcohol ban. Bihar is a dry state now. So there was huge discussion what happened, whether road traffic accident increase or decrease. And a few years later, sir, when we did the assessment, there were drastic reduction in road traffic accident and gender-based violence in Bihar. So these this MCC data can help us in measurement of impact of your policy level decision. And the final is set priorities for intervention. Once we know, if we start in 2022, say by 2025 or 26, when we have good quality data, why how many percentage of people dying because of various diseases in Nagaland, you can set your priorities, you can dedicate more fund targeted toward those diseases. So these are the basic, the four reasons why it is important to focus on MCCD.
It is indeed a privilege for me to be part of this program where the various organizations, departments come together to converge their activities to ensure that there is proper delivery of services and collection of data. And I thank God for this opportunity, and I thank the organizers for giving me this time. Births and deaths. There are two vital events in a person's existence. The recording of births, deaths, it gives us legal existence for a person. But not only that, these data, the recording, the data on births and deaths, these are important data inputs for policy formulation, for planners, for professionals. Therefore, the importance of having precise, authentic data is there, and we are all aware of that. In India, registration of births and deaths is mandated under the 1969 Registration of Births and Deaths Act, and in the states, the respective states have come up with their own rules, births and deaths rules. In Nagaland, the registration of births and deaths rules is in force. And at the national level, the ORGI, Registrar General of India, under the Ministry of Home Affairs, is the authority for registration, for collection of births and deaths and population registry. In our state, the Economics and Statistics Department has been given the charge for registration of births and deaths. It varies from state to state. In some states, it's the Health and Family Welfare Department which does the registration of births and deaths. In some cases, it's the Municipal Affairs. And in other states too, Economics Statistics Department. In some states too, Economics and Statistics Departments take care of births and deaths. In our state, we have a Chief Registrar of Births and Deaths at the state level. Then in the districts, we have the District Chief Registrar of Births and Deaths, where the Deputy Commissioner is the Chief Registrar, with members from the Health Department, from the Education Department, so on and so forth. We have about 1,468 registrars in the state. And the registrars in the villages are the school teachers. We also have the 11 district hospitals having registration units for births and deaths. And as Dr. Tina has already shared, they are already doing registration of births and deaths. In some cases, they're very active. In some cases, not very active. We have also designated the nursing in charge in the CHCs, the PHCs, as the registrar of births and deaths. When it comes to registration of births, it's relatively good, better than deaths. About 72,000 registration happening in a year on an average. But when it comes to registration of deaths, then it's still very low. And it's shared by Dr. Kamo. Unless there is a reason, a purpose, people don't come forward for registration of deaths. Now, when it comes to deaths, we have to medically certify the cause of death. And this can be done only by the medical practitioners. This cannot be done by others. And as already shared by Dr. Ravikant, the percentage of registration of medical cause of death is still very low, at 7%. And there is a need to improve this cause of death, as the cause of death, as insights into the cause of death will give us reason to introspect why it is happening and will help policy makers to formulate plans so that the delivery of medical services reaches to the people appropriately.
In Nagaland, a lot of work is going on for improvement of health and public health and medical services, as we all know. Recently, the CSR conclave was organized, the first ever CSR conclave in Nagaland. A good number of companies came. Honorable Union Finance Minister was here, as we all know. And a number of companies had committed various projects to be implemented in Nagaland. I am told about 79 projects have been committed in Nagaland, worth about 50 crores. But what is a matter of satisfaction, I would say, is that out of these 79 projects, almost 50 projects are in the health sector. And out of these 50, 17 projects are relatively prominent health projects. And total worth is about 25 crore for these projects which were committed in under the first CSR conclave. I don't say that it is a big amount of money or the number of projects that are coming is very large, but then anything which helps in improving the health systems in Nagaland is always welcome, and that's why we gratefully acknowledge all the contributions and the projects that have been announced by the corporates for Nagaland. We have committed that we want to implement them in the right spirit and so that the benefits of these projects reach the people. In the last 2.5 years, we have been grappling with the COVID pandemic. All of us, our doctors, our nurses, our health workers, our frontline workers, our CSOs, our faith-based organizations, churches, and every well-meaning person, our tribal bodies, they have all contributed in managing the COVID pandemic in Nagaland. The government also, in its own way, has tried to improve the facilities in Nagaland, and the entire government machinery has been involved in managing the pandemic. Certain parameters we have performed better than other states. Certain parameters we might be lagging behind, but there has been no let up in our effort. And one good thing is that for the long run, a lot of improvement has come about in the health facilities. As we all know, our wellness centers, primary health centers, hospitals, they have all been improved with better facilities. Our reporting systems have improved. In fact, Nagaland COVID tracking system and reporting system was considered to be one of the best in the country. We have had new health blocks added to our hospitals. A large number of doctors and health workers have been recruited by creating additional posts. So all these facilities, they are put in place for the benefit of the people, and we are very happy that this will go a long way in improving our health systems. The other two major projects that are under implementation, I think everybody knows. Nagaland has got two medical colleges. One of them is in Kohima and the other is in Mon. The Kohima Medical College is getting ready very fast, and by I think 75% of the work is now complete. And next year we are hoping to start the academic session. So all the necessary preparations are underway. Medical College Mon may take 1 or 2 more years, but eventually it will also come. Then the other major intervention that the state government is planning to make is the Chief Minister's Health Insurance Project, as we all know. This scheme will basically take care of the in-hospital expenses of insured persons, and it will aim at universal coverage of all the population of the state. So when we talk of affordable health care or affordable cancer care as the topic for today, we know that in our country, since we do not have an insurance-based system, people have to spend money from their pockets. And if you are hit by a major disease, then sometimes even well-to-do people, well-to-do families, they are pushed to poverty. They have to sell their assets and then they become poor. So that is the problem we have been having. Various insurance-based schemes are being launched, and slowly we are moving towards a universal insurance-based system. Hopefully Nagaland will be one of the early states which will actually have this universal healthcare system. So since we are spending a lot of money from our pocket, affordability becomes a major issue. And I compliment the efforts of Tata Memorial Center in this regard, that they are working to make cancer care affordable. It's a great kind of help for Nagaland, because as we hear, Nagaland has one of the highest incidences of cancer, and a lot of patients, their families, they spend huge amounts of money on cancer care. It is also necessary that these facilities actually are set up in our state. And here actually I want to, it is a wish also, and it's a request also, that perhaps the Tata Memorial Center could set up a unit in Nagaland also, and it can be a part of maybe one of the existing hospitals, or it can be part of the Kohima Medical College, like that. So if there is any possibility in this regard, we will take up with the concerned authorities, and we will try to get it set up. I know Government of India is giving a lot of focus on the Northeast, and several other states in the Northeast, they have got their cancer hospitals very recently. Nagaland is yet to get one. So we are hoping that in Nagaland also the cancer care facilities will come of age very soon. As far as the MCCD is concerned, this medical certification of cause of death, this of course is a very specialized area, and for me personally it was very educative, I would say, because as an administrator, when I look at it, I see it more from the perspective of how the government does it and how it benefits the people. What is the consumer convenience or user convenience in doing all this? But when you look at it from that research perspective, from gathering evidence perspective, then it is a totally different world. Dr. Khamo's, I think, pioneering study is very, very insightful. Madam, my compliments to you for doing such meticulous work. This is indeed very important for decision making, and I am happy that we have people within the state who can do that kind of, they can, with their very hard work, they can come up with those kind of international level studies. As far as this registration of births and deaths is concerned, the other day we were arguing over the registration of births. So with the Economics and Statistics Department, we were concerned that why birth certificates are not being issued online. Why these birth certificates have to be issued manually. So every aspect, everything that we do has a lot of layers. And I was told that there are issues in why birth certificate sometimes is not being taken online. I do not know whether death certificate is also issued online. It must be, yes. But then For medical certification, again, it is a more complicated process, and as earlier speaker mentioned, Nagaland is behind other states in terms of certification of this kind of deaths. We are only at 7%, that is 24th in the state. I would like this rank to go up, because these days all progress is being measured in terms of ranks. So we would definitely like to have our ranks go up. Maybe at least we should reach the national average, if not better than that. That should be our target. And I am very sure that this particular program workshop that you are holding, this will go a long way in sensitizing people, and the departments involved will put their heads together and work on achieving these targets. So all the very best for this workshop, and once again thank you TMC, and thank you all the guests who have come from various hospitals and centers to be here in Nagaland. Kohima is a very nice place. I'm sure you are enjoying the weather here, although today it's a little hot. But otherwise, from the hustle and bustle of big places, I think you can spend some quiet time. So while you work, also try to explore lot of good things that Kohima has to offer. Visit our villages, look at the local culture, try the local cuisine, and you will get a real feel of the place. So thank you very much, and thank you once again for inviting me. From the state government side, I can only give an assurance that whatever support, assistance is required, we are there to help you. And of course, our departments are involved. I am sure they will provide their best effort in all these, your project, MCCD also, as well as how you can make cancer care affordable. That is actually the topic for a complete and a more intensive deliberation on a much deeper scale, I would say, because affordability has many dimensions. And so I'm sure in next 3 days you will be discussing all this. I'll be very happy to know the outcome of your deliberations and what role the state government is expected to play in that. So with these very few words, thank you very much, and God bless. Thank you.
May I invite all dignitaries on the dais. Madam, please come to launch. So we are launching this training manual of doctors on affordable cancer care. So